Okay, well, everyone, thanks so much for joining. I think we have a critical mass, so Rep. Davids, feel free to take it away.
Okay, thanks, Zach. Well, good morning, everybody. Thank you all for joining us. We are gathering here today because of the health and well-being of our families, of our neighbors, and the fact that that health and well-being is under attack right now. We've seen this before, but right now we're in a situation where the President Trump and U.S. House Republicans are pushing through with a partisan budget that, unfortunately, right now would cut Medicaid. And that threatens the health coverage of children, of seniors, of people with disabilities, of hardworking Kansans who rely on Medicaid to live safe, healthy lives. And I want to start off by being very clear about this. I support responsible government spending. We should be cracking down on things like waste, on fraud, on abuse. But what's being proposed right now by the federal Republicans is not responsible. In fact, it's dangerous. These cuts would force families to pay more or pay more for coverage, to travel farther for potentially worse care, and all of that to fund massive tax breaks for billionaires and for big corporations. And this is at a time when so many Kansans are already feeling the strain of rising costs that really no one should have to deal with. People shouldn't have to choose between putting food on the table and seeing a doctor. Folks shouldn't have to drive hours just to get basic care because their local hospital shut down. And folks definitely should not have to worry about whether their kids or their parents or their neighbors are going to lose coverage because politicians out in Washington are putting special interests above and ahead of hardworking families. And that is exactly what this budget would do. Here or in Kansas, we know just how vital Medicaid or for us can care really is. And you're going to hear more about that today from some of the guests who are taking time out of their day to join us. But before we get to that, I do want to put some of these numbers into perspective. There are some serious implications here. There's a nonpartisan analysis. I'm so used to saying bipartisan. According to some of the nonpartisan analysis that we've seen, this extreme Republican budget would strip healthcare from up to 13.7 million Americans. And that could include more than 61,000 Kansans in the third district, 41,000 children, 11,000 seniors that are on can care. And I hope that folks understand that this coverage helps so many different ways. It helps new moms get critical care after childbirth. It supports seniors who need long-term care. It helps people with disabilities to be able to live independently with the support of home and community-based services. This is not just about individual care, though. Medicaid helps keep our communities afloat. Slashing Medicaid would mean more rural hospital closures, and we've already seen too many of those in Kansas. So more rural hospital closures, fewer providers, drastically reduced access to mental health and substance abuse treatment. And this is all especially in our rural communities where care is already hard to come by for so many people. So I just, again, I just want to make sure that this is so clear to people. These cuts don't just hurt the people on Medicaid, they would hurt all of the people in Kansas. Healthcare healthcare needs to be more affordable and more accessible, not more expensive and out of reach. And I can tell you that this has been true since I started, but I'm not going to stand by while we see extreme proposals. We see extreme, in fact, out of touch politicians in DC trying to gut Medicaid just to provide tax breaks for billionaires. And I am so appreciative that we've got folks who have been speaking out and are willing to, because I don't want you to just take it from me. I want you to be able to hear directly from the people who understand this, because they're going to be the most impacted. Because every single statistic that you read, every single number that you see is backed by a real person, is a family that's already living paycheck to paycheck. It's a parent lying awake at night wondering if they're going to be able to get care for their kid. A caregiver that's worried about their aging parent, and worried about whether or not these cuts are going to go through. And every single person dealing with this is a real person. These stories are real. The folks that we're going to hear from today, their stories matter. And so I'm so appreciative and want to thank the Hink family. Thank you to Corey and Samantha for joining us today, for being willing to and having the courage to get on here and share your stories. And yeah, I mean, I'm here in Washington. I'm fighting for your families, for our guests. I'm fighting for everybody's family who's watching, and for every Kansan who deserves the peace of mind that comes with knowing that you're going to be able to get the care that you need. So with that, I'm gonna stop now. I'm gonna turn it over to the Hink family to kick off with our guests.
Okay. Hi, thank you. I'm Mark Hink, and this is my wife, Patty.
Good morning.
And this is our son, Brian Hink. Brian is the oldest of our children. He is 49 years old now. He has multiple disabilities, congenital disabilities stemming from genetic deletions that occurred in the womb. He has intellectual disabilities. He has epilepsy. He's on the higher end of the autism spectrum, so he's nonverbal and has OCD. In most activities of daily living, he functions at about the level of a 3-year or 4-year-old. He needs assistance with daily living skills. He can feed himself, but he needs to have somebody cut his food up into bite-sized pieces. He needs help going to the toilet. He needs help dressing and undressing, taking a shower, brushing his teeth, all of those things. He can't add or subtract. He can't make change. So he can't work, can't support himself. So he relies on Medicaid to help pay for his medical expenses, doctors, dentists, hospital stays, clinics, and so on. And he does see 9 medical professionals, some of them multiple times a year. And that doesn't include any testing that is needed to keep track of like his diabetes. It also pays for his maintenance medications for his OCD, his epilepsy, and his erosive gastric esophagitis. Importantly, it pays for his HCBS that he gets for his day and residential services. These are provided by L'Arche Heartland, which is located here in Overland Park. They provide residential services for 19 individuals, including Brian, and day services for 30 individuals, which also includes Brian. These day services do a good job of getting the people out into the community. They do things like staff meals on wheels. They go bowling. They take walks. They do recycling. They keep them engaged in the community, which is very beneficial to all of them. The direct service providers that take care of Brian and his colleagues cook and serve meals. They clean and they provide personal care. Some of them live in the group home. Others take shifts and come in and out. In Brian's case, he does get up to go to the bathroom like many men his age and at night. And so he has to have 24-hour care because, again, he could have a seizure and he needs assistance going to the toilet. So they do provide 24-hour care. L'Arche, like many other organizations that are similar, provide a lifeline to the community for Brian and the other individuals. Otherwise, these disabled adults would be homebound with parents who are aging and can't provide the level of care that is needed. in Brian's case, some of his fellow community members no longer have any living relatives in the area, so L'arche takes those people to their medical appointments and so on. So it's Medicaid is just totally essential to provide the mental and physical health and well-being for Brian and others like him. And loss of funding in his case could result in loss of control of his diabetes and loss of community supports. It would place the burden of care on family members who can no longer provide that care. So um, that's pretty much our story, and we do appreciate you giving us the opportunity to talk about it. Thank you.
Wow, that was a great story from the Hink family. So my name is Corey Craig. I own and operate a hospice, home health, and private duty company in the state of Kansas. We service families like the Hink family. We provide activities of daily living to our patients, help with showers, help with medication management, essentially anything that a family needs to have assistance in the home setting. That home setting could be an assisted living, it could be a nursing home. We also work with Medicaid through the room and board pass-through. Traditionally speaking, Medicaid already reimburses us at a lower rate than traditional insurances. And my biggest fear in the case of more Medicaid cuts is that we're going to marginalize a group that is already kind of marginalized, especially in rural areas. And so I'm here to advocate for at least at the minimum keeping things the same because we are doing our best out here to try to service our rural communities. And it is more difficult to do so, and more Medicaid cuts will make that more difficult for us to service families like the Hink family because they do deserve care just like anyone else. So that's my biggest fear, and that's why I'm here to advocate as well.
Hi, thank you, Corey, for everything you do. My name is Sam Armistad. I'm a mother of 2 young boys, a wife, and I am finishing up my 14th year as a public elementary educator in Kansas. I'm also the sibling of an adult with significant intellectual disabilities. My brother Connor is an adult with intellectual disabilities. He receives funding for his adult day services through the home and community-based services waivers through Medicaid, specifically CanCare. Connor attends day services Monday through Friday. His day service provides him with meaningful work and interaction with the community. His day service provides the community with goods, services, employment, and growth to the local economy. Connor has thrived at his day service and continues to learn and grow through the program. Without Medicaid funding, Connor would be unable to access day services. There was a period of about 6 months when Connor aged out of the public school system, but was still waiting on his Medicaid funding. During this time, our normally outgoing, happy, and funny Connor became irritable, angry, and depressed, and it was devastating. While we, his family, did the best we could to fill that void, he struggled without the structure, purpose, and independence school and day services have given him. Connor currently lives with our parents, and this arrangement works well for now. They are able to provide the care he needs, and both my brother Cole and I, along with our spouses, help out as much as we can. Connor enjoys regular visits from his niece and nephews, and he takes his role as their uncle very seriously. He also actively participates in Special Olympics and church-related activities, which are important parts of his routine. However, our parents are getting older, and we know this arrangement is not sustainable long-term. We are counting on residential funding through home and community-based waivers to be available for Connor when our parents are no longer able to care for him at home. Both Cole and I and our spouses have full-time jobs and young children, which limits the level of care we can personally provide on a daily basis. I truly don't know what we would do without home and community-based services through Medicaid. These services are essential for Connor's well-being and independence. Without them and without Medicaid support, we simply cannot afford the level of care he needs. The loss of these services would place an overwhelming strain not only on Connor, but also on our entire family. Connor is deeply loved and supported by his family. He deserves the opportunity to live a meaningful life with dignity and connection. I'm heartbroken, terrified, and angry that many of our representatives in DC are working to deny basic care to our most vulnerable populations. Thank you for your time, and thank you, Representative Davids, for continuing to fight and advocate for your constituents.
Thank you. Well, thanks, Sam, and Corey and Mark and Patty for taking the time to share. I really appreciate all of you sharing your stories. And today we focused a lot on the what I consider to be dangerous cuts to Medicaid and that are in the partisan budget proposal that we're looking at. But it's important also to understand that that the harms are not limited to Medicaid, that it doesn't stop there. This budget would also take food off the tables of Kansas families by slashing emergency food assistance programs like SNAP. It would do things like gut the clean energy tax credits that I was proud to help pass. That would deal a major blow to manufacturing jobs. We would see rising energy costs for working families. And this budget also kind of threatens the retirement benefits of government employees, which are the very people who are helping to keep these programs running and helping our communities, and who unfortunately have already been targeted by the president. And it's that much more infuriating that this is all to dish out tax giveaways to billionaires and the wealthiest corporations. And the real kicker is that if all of that wasn't enough, this budget plan would actually add hundreds of billions of dollars to the deficit and pile like $14 trillion in new debt onto the backs of future generations over the next decade. And, as someone who was raised by a single mom, she raised me and my brothers. Our family knows what it feels like, the stress, the anxiety of living paycheck to paycheck and worrying about whether or not you're going to have enough to cover groceries or rent or gas. And, right now we're seeing this across the board. Prices are up, retirement savings are down. We're seeing Trump's tariffs are hurting our farmers. And for so many Kansans right now, just one unexpected bill, one thing going wrong could be that one thing that tips somebody into crisis, tips a family into crisis. And now is not the time. This is the worst time to be looking at something that would pull the rug out from under folks who are doing everything they can to stay afloat, which is why I'm pushing back on this. And, very early this morning, I introduced a slate of amendments to the Republican budget, amendments focused on things like protecting Kansas families and bringing some common sense and some stability back to our economy and our government. For everyone watching, my office will share the list of amendments following today's press conference. But we're talking about measures to do things like protect Kansas manufacturers from President Trump's threats, restoring life-saving research funding for institutions like the KU's Cancer Center, reversing the impact of Trump's tariffs on our farmers, lowering premiums for the 44,000 Kansans that receive their health coverage through the ACA, and more amendments, but we'll share those. And, like I said earlier, I'm all for fiscal responsibility. I want us to have a more efficient government. This budget doesn't do that. It doesn't go after waste. It doesn't close corporate tax loopholes. It's not cracking down on fraud. What it does is protect tax breaks for billionaires and these massive corporations, and it's sticking struggling families with the bill. And from my perspective, and the reason that I'm here is because I believe that Kansans deserve better. You know, Kansans deserve smart, targeted policies that are going to do the things that they need. We need to be reducing waste. We need to grow our economy. We need to be supporting hardworking people and not trying to push through reckless cuts that are going to leave our communities hungrier and sicker and even further behind. So, you know, my plan is to continue to push back. I'm going to keep fighting these extreme policies because that's literally what the Kansas Third sent me here to do. So, once again, I appreciate our guests, and I will turn it back over to Zach. We'll open it up for questions. I think Zach's going to moderate that.
Yeah, well, thank you so much, everyone, for sharing those thoughts. For those on that do have some questions, feel free to press the raise hand button, and then I will allow you to speak. So feel free to press that if you have a question.
Should I press the button? Just kidding.
All right. Well, if there are no questions, thank you all again for being here. Just so everyone is aware, we will be sending. Oh, I do see one. Go for it.
Hi, Jack Harville from the Topeka Capital Journal. I saw we had some HCBS, and I know Republican messaging is this isn't going to affect the people that it was intended for, which is disabled, uh, in poverty. I did want to ask if Kansas is at less risk as a state that hasn't expanded Medicaid, of being impacted by these cuts.
So, I mean, the brass tacks answer is no, it's not. We're not as a state at less risk. I think that the idea that because we didn't expand Medicaid, which by the way, I'm going to continue to push for us to actually be able to get the almost 160,000 Kansans that would be eligible if we were to expand Medicaid. I'm going to keep fighting to find ways to get them coverage. But I have heard that as an argument that the idea that states that didn't expand are going to not be harmed as much. But the reality is that the cuts that are included in this budget would lead to real issues for long-term care facilities, would lead to issues for the system as a whole, because some of our providers, especially in the rural areas, would face really tough decisions and might end up needing to close. And the reality is Kansas has already had too many of our rural hospitals shut down. People are already having to go too far to get care. And I just, yeah, I think that I just think the idea that a state like Kansas that didn't expand Medicaid is going to be less harmed is incorrect. Corey, I don't know if, oh, okay. And Patty, I see you raising your hand. Go ahead.
Davids, okay. Thank you. Also, what he's missing is that the SNAP is also through federal funding, and Brian's group home receives, many of them receive SNAP benefits. They cut back on SNAP. They already go to Harvesters, which is our local food bank, for food as it is now. If they cut back on that much more on SNAP, that means we already provide dinners several times a month for our son's group home. That means we're going to have to take more of our money, our Social Security, to pay for his group's home money, and provide funding for or food for them, because they don't have the federal funds available because SNAP has cut back. You can only cut so many times before pretty soon the group home may collapse altogether. And then Brian will be back here trying to live at our house when he's up all night, all during the day. We're in our 70s. We can't maintain that pace like we did when we were much younger. It would be devastating.
Thank you for sharing that. Corey, I don't know if you wanted to jump in on. Oh, and I'm not trying to exclude Sam. I do think that there might be particular things if you want to share about the just the residential services and that sort of thing.
Yeah, Medicaid already reimburses us at a lower amount than traditional insurances, PPOs, HMOs, and Medicare. We mostly work with seniors at home and help them, but we also work with Medicaid, and that can be any age. And they reimburse us at a lower rate, and we either are at a break-even point or we take a loss already on a lot of those patients. And I think a lot of companies choose not to accept Medicaid because they don't want to take that loss or that break-even point. And that just provides less options, less competition for patients at home that need care. And because of that, they'll receive less care or no care at all. And that's just not fair. And I can speak for my industry and just my industry, but we do our best with patients on Medicaid, and we want to give them the best care possible because they're people too, and it doesn't matter what insurance they have. And so we do that, but we do take that at a loss at times, and that is a struggle for businesses like us because it's not feasible to do that forever.
Thank you. Oh, did I? Okay.
I think we have time for one more question. If anyone has one, feel free to raise your hand. Okay, well, seeing none, thank you again for all being here. Thank you to our guests. Thank you to Rep. Davids for hosting us all. Our office will be sending out a press release after this with a link to this recording, so feel free to check there for anything. But thank you again, and we will talk to you all soon.
Thank you, guys.